Welcome to day 2 of our workshop series presented by the Pacific Alliance around COVID-19. And I just wanted to welcome you all really quickly to the Hanaho'oli School of Professional Development Center. I'm Amber Strong Makayao, and this program is a partnership between the University of Hawaii at Manoa and Hanaho'oli School, where we provide workshops, professional development for the community at large. And so since this is day 2, I want to get started right away, and I'm going to pass it off to Pauline Chen.
Aloha, everybody. Let me make sure I'm not muted, and let me start my video. Welcome, everybody, to the second session of Safer School Reopening. I'm so delighted that you're back here today, or if you're first time joining us, welcome, welcome. We had a very interesting session yesterday, and I realized that today it's going to be a bit more from a practitioner perspective. Jamie, if you are here, could you kind of show, let me see, I don't know if Jamie's here. I would like to perhaps, Ruben, if you are ready, the schedule is such that the person that goes on first is Kaleolani and Jamie Psak. But if Jamie is not on board yet, perhaps Ruben, would you be able to go first?
I'm ready to go, Pauline.
You're ready to go. Okay, so let me welcome the panel, and I know people will show up. Kaleolani Hanohano and Jamie Psak will be second. Ruben Juarez, who is with the economics department, will go first. And then teachers, Jamie Kaleo will talk about her work at Kaiser High School. Jamie is also a adjunct professor with the College of Education in Health. Kaleolani and olinokaimana will then talk about their work with the modules. So without further ado, let me introduce Dr. Ruben Juarez. We're very happy to have a really incredible person to help us with the research. Again, we are funded by the National Science Foundation for our curriculum, so that's a research piece too. We're also primarily for this funded by PAAC, Pacific Alliance Against COVID-19, under the national NIH. So Dr. Ruben Juarez is a professor in economics and also with a group called UHERO, which is a UH economic research organization, and does a lot of work with statistics and studies and analyses. So without further ado, Dr. Juarez, would you please begin?
Hi, everyone. Thank you so much, Pauline, for the introduction, for organizing this workshop, to all the PAC education team, for all of you to be here today. I'm going to quickly give you an introduction. Alika set the ground yesterday, so I'm going to skip a lot of the slides real fast. But basically, I'm just going to give you like an idea of some of the data that we are collecting, some of the super early preliminary results that we are seeing. And then at the same time that we are getting this data, so we are passing it to stakeholders, and including, you know, the principals and the Department of Health, Department of Education. So let me see what's going on. Okay, so okay, so sorry, I'm just getting all this notification that someone is entering. So as you can remember from yesterday, so this is the trend that we are seeing on the number of cases of COVID-19 in Hawaii. There is a huge surge, about 170%, so 1.7 times more 7-day average than what we were at the peak in summer 2020. This is reflected on disparities across different communities and across different races. So last year when we started this project, we had Native Hawaiian Pacific Islanders who had, Native Hawaiians in particular, right, who had 18% of the infections, but 21% of the population. Today, we are seeing a substantial rise on the number of Native Hawaiians. infections to 23% of the infection that we are seeing today in August 2020. The good news is that for Pacific Islanders, who last year we were seeing at 27% of the infections with only having 4% of the population. Today we are seeing only 17% of the infections. So that's a substantial decrease from last year. Same thing with the Filipinos. So they decreased from 21% of the infections to 19% right now. So in part, one of the main reasons why we see these differences right now is because of the gaps on the population with respect to vaccination. So, and if you go back to this graph on the right hand side at the top, so you will see that Native Hawaiians, even though they make up for 21% of the population, they have only received 13% of the infections. We can also break this down across age groups, where younger age groups, 12 to 17 or 18 to 29, represents the age groups that have the lowest proportion of vaccination in the state. There is also regional disparities, as you can see in this map, so that the darker areas are areas that have the largest vaccination rates. The lighter areas, such as Waianae, Nanakuli, are one of the areas that have the lowest vaccination rate in the state, with less than 35% of the population being vaccinated. So, and then that's actually one of the main reasons why our study is actually based in Waianae originally, and then at the same time targeting this youth population. And we're trying to address these vaccination gaps. We're trying to address these testing gaps. So now, why do we have such low vaccination rates? So this is coming from a CDC survey of the entire state, not restricted to Waianae. But the top 3 reasons why there is such a big vaccine hesitation in the state is because people are concerned about the side effects. They don't trust the COVID-19 vaccine, and they don't trust the government. Now, what I want to remark about this data is that this does not reflect hesitation among underserved communities, especially those enriched with Native Hawaiian Pacific Islanders that we are targeting in the study, as well as children. So, so PAC is collecting this information, and today I'm going to be showing you some of that hesitation. So to give you an idea about the type of data that we've been collecting, so we call this the Pac Data Hub, that until today has performed over 3,000 tests in the state, and we have information from 1,358 unique individuals. So we do something that we call serial testing, where we offer this testing once a week across different schools, and then so we have individuals who repeat often. So from these 3,000 individuals, so 1,358 are unique individuals. Our survey is a pretty comprehensive survey. So sometimes our participants actually are a little bit concerned that it's a little bit too much that we're collecting, but we're really hoping to use this information to be able to understand what are these reasons for hesitation. So today, from the over 100 variables that we collect, I'm going to be looking at some demographics. I'm going to be looking at vaccination rates. I'm going to be looking at attitudes toward testing and vaccination. I'm going to be looking at trust, and I'm going to be looking at sources of information. But then there is a few more things that we also collect. And here is my first slide, coming from data that we are collecting. And this actually reflects the percentage of individuals that are in our data set. So we have 23% of our individuals are actually youth, 18 to 17. 22% of individuals are on the 18 to 29 range, which are these are the age ranges that have the highest vaccination hesitancy. And what we can see is that especially on the age range of 11 to 17, because of the way that we are targeting individuals at schools, we are getting a substantially low on vaccination. So we actually see that only 27% of the students were vaccinated. And this is in the summer. This is before we impose, or the schools impose the mandates for athletes to be vaccinated to be able to play sports. So there is a significant under-vaccination in youth, and we are trying to understand why that's the case. As you can see, because of the way that we recruit, so we're recruiting right now from Waianae, we're expanding this week to the Big Island, 3 schools in the Big Island. So we have a substantial increase of Native Hawaiian Pacific Islanders. Okay. And this is across all age groups. So now what we ask is, and sorry for this. So yeah, so what we ask is, okay, so from those individuals who are not vaccinated, what is the likelihood that you are going to be vaccinated? And what we can see is that 23% of the sample basically are considering to be vaccinated, but there is still a substantial gap of individuals, like over 30%, who are not interested in getting vaccinated in our sample. And this is from the people who haven't been vaccinated. Not much difference with respect to school. So from now on, the analysis would actually be based for everyone. So then, one of the things that we wanted to understand is what encouraged you to be vaccinated? So why did you receive a vaccination shot? Or for those who are likely to be vaccinated, so why would you be vaccinated? And what they responded to us, 89% of them actually, they want to keep their family safe. This is across Native Hawaiian Pacific Islanders. For non-Native Hawaiian Pacific Islanders, we see an 84% of those responded that their family is the main reason. Keeping themselves safe was responded by about 70% of individuals. And then on the lower end, so basically we see that their doctor told them to be vaccinated. The requirement, just started coming up recently, and then also chronic health problems at the bottom. Then similarly, so we ask individuals, so what are the reasons why you wouldn't be vaccinated? And this is again for those individuals who haven't gotten a shot and indicated to us that they are unlikely to be vaccinated. And trust was actually the main reason. So they just don't trust that the vaccine is safe. 82% of individuals are showing this. Not knowing enough about the vaccine is also an issue, and concerns about the side effects is also at the top 3. At the bottom of it, so we see people that are allergic to vaccination. They just don't want to pay for it, even though people don't have to pay for it. And they just don't believe that COVID pandemic is as bad as people say. It's another reason. We did this comparison as well between Native Hawaiian Pacific Islanders, non-Native Hawaiian Pacific Islanders. We see an increase, as you can see, on some of the trust, vaccination, side effects, and about not knowing enough, which there is a disparity between Native Hawaiian Pacific Islanders and non-Native Hawaiian Pacific Islanders. So, but this is actually where education can help. This is actually one of the reasons why we wanted to collect this data on attitudes towards vaccination. Another thing that we look at were issues of trust. So we wanted to understand whether there are differences in trust between individuals who are vaccinated versus those who are not vaccinated. And what you can see from this table, so I'm going to present you 4, is that trust for your doctor or healthcare provider is actually higher on individuals who are vaccinated versus those who are not vaccinated. Trust on faith leaders also came up a little bit higher for vaccinated versus unvaccinated. Trust on cross friends and family members is higher, and trust on the people that you work is also higher for vaccinated versus unvaccinated. Again, this is what education can help. Moving on, so trust on newspapers, TV, online was also slightly higher for vaccinated. No differences, at least statistically, for social media. You'll see in a second a little bit more. But then something that was substantial is actually trust on the government and trust on the US coronavirus task force, where vaccinated individuals trust the US government more and the US coronavirus task force than unvaccinated individuals. And again, this is where education can help. And this is a long-term project, of course, for educators. We also ask individuals, so what are the sources of information? Like, where do you get the news more often? And what we saw is that unvaccinated individuals get the news. So 59% of the news that they get are actually coming from social media with respect to vaccinated individuals. Not statistically significant differences for TV and the others, but social media was an important component. And that's where we think that can be one of the main reasons why we are seeing the increase of the spread of misinformation. Finally, I just want to conclude really quick. So, so what are the main differences between vaccinated and unvaccinated? Vaccinated are less reliant on social media, more trust on doctors, faith leaders, close friends, TV, radio, news, government, and the coronavirus task force. Unvaccinated are exactly the opposite. And as educators, you are key to change this trend for your students by teaching reliable sources of information. And the PAC curriculum is one of those reliable sources that you can use. So thank you.
Mahalo for this very important presentation. We have time for a couple of questions, and I don't know if you'll be able to stay with us, Ruben, to answer some of the questions that come in later on.
I will. I'll say until then.
Okay, great. But are there a couple of really burning questions right now before we go to Jamie and Kaleo? Okay, I'm looking in the chat. These are more, let's see, not so much directly related to what you're doing, but one of the questions was, do you have exact numbers? Okay, no, there is one. Ruben, is there any association between historical pandemics and this study?
We do collect a little bit about learning, about historical aspects. We haven't analyzed the data, to be honest, so I don't know at this point.
Yeah, maybe I could answer that one briefly. We are looking at which particular curriculum module. So first module is the historical one. The second one really looks at how we can prepare students to be public health outreach educators. The third one is on mitigation strategies, or what you can do right now with in your classes with your students, how you can prepare them to be as safe as possible under conditions now that really are maybe under really well thought out strategies. School may actually be safer than just being out in the community. And then finally, the fourth one, which is the updated one, is going to be on tests, vaccines, and variants. So we do want some feedback, and you will have that opportunity to give us some feedback in the evaluation. So what we'll do, we'll continue going along. And then as you have questions, Ruben has an incredible data set. And Ruben, maybe you could talk a little bit about potentially inviting teachers to kind of collaborate in the collection of data. Do you want to speak to that a bit?
Sure, absolutely. So one of the things that we are doing is, and we just started doing it last week, is if you are interested in teaching the modules and you're interested in collecting data from your students, so we can set up a unique link for you to invite your students and their family to come and do the data collection of the survey. And we have resources to pay up to $25 per participant. The survey has been approved by the IRB at the University of Hawaii. So basically you just need to let us know. I'm teaching the curriculum. I'm ready to do some data collection. And although we cannot give you back the data basically identified, so we can always share the data to you, back to you, de-identified. So you can see what's going on with your students, with your community.
So would you say that if they would be interested to contact you through the an evaluation question will be, are you interested in following up with any of the research, or through, you have the PAC info contact?
Yeah, they can just do the PAC info contact.
Okay.
Yeah.
Okay, so it would really help if there is a much broader input into the numbers on the survey results that Ruben just shared, especially as the approval of the Pfizer has gone through, and then likely the Moderna, and then likely the Johnson & Johnson given more time. So thank you very much, and thank you for being willing to stay and take questions later on. Right now, what I would like to do is to introduce Kaleolani Hanohano and Jamie Psak. Kaleo is a graduate student in the College of Education Curriculum Studies. She teaches modern Hawaiian history, AP, US history, I believe it is. Tell me if I'm, just go like this if I got it wrong. And teaches Hawaiian language. And she has been teaching for about a number of years. I won't say, but let's say experienced teacher. Jamie is over at Kaiser High School. She is a health teacher and has also taught classes in the health program for future health teachers at the University of Hawaii. They will be talking a bit about the ways that they have received COVID guidance from the DOE. Thank you, Kaleo and Jamie. If you'd like to screen share, please do.
Aloha mai kako. I will go ahead and go first, if that's okay. I'm going to go ahead and share my screen. Ano ai na hoa. And let me present for you. So mahalo nui ya Okoa Pauloa for your wonderful time and for your dedication to the discussion. This is my place. So e ho'i ka piko, return to the source. This is Kahuku High and Intermediate Schools and our mission, learning today for lifelong success in college, career, and community. And our C3 journey provides all students with customized grade level experiences that lead to cherished memories, a quality education, and a post-high school plan. Our school-wide behavior expectation is respect, responsibilities for self, school, and society. It's known as the R2S3 and to choose aloha. I just want to give you a brief on my two schools, actually. Prior to the closure, the first closure of our stay due to the COVID pandemic, I was at Kaimuki High School for 20 years. And so you can see that the population that started my journey here at Kaimuki does have somewhat of a little bit of a similarity to what I moved to last summer at the end of fourth quarter, and moved into my first quarter and first year at Kahuku High School. So just giving you some background, 45% at Kahuku High School are free reduced lunch, 66% Native Hawaiian Pacifica, which includes Oceania. I wanted to bring to you some information. Every year I do a survey, and this year I decided, well, what are the students thinking and saying about COVID? 86 of my students actually responded. And of these, 24 are seniors, 61 are juniors, and one of them is a sophomore. And then of course, of my demographics, 50 of the students of 86 of those that responded are Native Hawaiian, Pacific Island, Oceania. You can see here, the students are sharing their voice. I am worried about becoming infected at school and with the coronavirus. And you can actually have a really good look at how my haumana are thinking, right? Yes, 22%, no, 43%, and 34.9% I'm not quite sure. But then when you look at the next question, which is I am vaccinated, 42 vaccinated out of the 75 that actually responded to this, which was optional. So it gives you an indication here that students know about or are worried about health, wellness, and their fitness so that they can continue to be in school. What actions or protocols at school will make you feel safe? Yeah, there's the students' voices. I like that masks are mandatory. Distance, more people are just crowding up in hallways and around the school. The school is trying, but the students don't care. Well, most at least. Provide vaccinations for more people. Implement a sanitation stations for students before coming on campus, maybe including temperature checks before entering into class, just to be extra careful. Requiring the vaccine to attend school. Interesting discussions, and also social distancing, but there is not enough chairs or places to go during lunch and recess if we were to social distance. And there is more. Remember I told you 86 students did give their opinions. What are your thoughts about vaccinations? 86 students gave their opinions, and this one was an optional. I think that getting vaccinated can keep you and your family safer from the virus. I don't believe in vaccinations, and I always think poorly of them. The vaccine affects everyone differently, and I have seen how sometimes it can ruin people's lives. So to keep me safe, I make sure to take extra precautionary steps to keep from contracting the virus. I don't care if it gives me a slight chance to help protect my family and friends because I have a slightly lower chance of catching COVID. I'm okay with that. I have some friends who want to be vaccinated, but their parents won't let them. So I'm grateful that I am vaccinated. And it goes on. I wish you guys could read all of them, but we have such a short period of time. So very intuitive, insightful discussions from the kaumana. And then it was the last two questions, they were optional. I know someone who was infected. Look at those numbers. And then I know someone who has died. You know, really big numbers here for me as a teacher. So this informs me in my practice. It really helps me to understand where my haumana are coming from. So this is what our school launched. The first day of school when teachers arrived, it was known as the COVID protection plan. And I have to share with you that every single period that our students came to classes, they actually cut this protection plan into periods, and each of us shared in our periods a section of the protection plan. So this is mine in my syllabus. All of these are hyperlinked to PAAC Collective, to tips to keeping children safe, getting accurate information. And all of these hyperlinks actually is in my syllabus. I have it in my Google Classroom, and it's actually a living document. So every time there's an update or something, I would definitely come in here or make sure that the students know what new information might be helpful to them. But then this was given to us to not only put on every single door and up on every one of our walkways and in the stairwells, but we actually, like I said, period 1, we actually focused on just this. Then when the kids went to period 2, period 3, period 4, period 5, so each class, they were not bored with the same information, but rather it was given to them in pieces so that they could frame a good understanding as we walked them through. What was really important, in my opinion, is this. I got to share with you our bulletin. So in our bulletin, it is open to the entire Kahuku Ohana. But our principal and also those very wonderful minds at our school, every single page of our bulletin has this addition here, parents and guardians communication protocol for COVID-19 related absences. And if you go to the second page, it's there again. And if you go on the third page, it's there again. So it was very mindful, very intuitive for them to make sure that every single page that a parent or a student was reading, it took them to more information on COVID and COVID responses that were going on at our school. And then offering them one more look at contact tracing. Now, this is where we really did this again in our advisories. So in our advisories, we also looked at this one more time as well. And we actually took it into pieces: cases, close contact household, close contact non-household, contact of a close contact, cases, close contact household. And it went on for us, and it was very good. It also gave kids and their families locators to where they can get more information. So I'm going to stop here and turn it over to my colleague and my friend. Aloha, Jamie.
Hi, can you guys hear me?
Yeah.
Okay, sorry, I'm just discombobulated right now because what happened is last year during the middle of all of this, my computer broke and I had to scramble to get a new computer and stuff like that. And in that process, our new technology person uploaded things, but I'm not allowed to like update anything. Like my Zoom today said you need to update it, and it won't allow me to put a code. I don't know the code how to update something, so I'm not allowed. So I'm like, oh my god, you know, I can't get on. I'm using my personal iPad right now. Well, my Kaiser driver's ed one, but it's old one already, which is off the record. But so I'm on my computer hitting my mouse, and I'm like, why is this not doing it? I've got, oh yeah, I gotta touch the screen of my iPad here. So so sorry if I'm discombobulated, and stuff that was on my computer, it's not on my iPad, so I can't really share anything, you know, with you. So oh my goodness, I'm not like, I feel like one of those students where, okay, I don't want to go, and then because
Do what
another
you
kid
can. Just do what you can.
went before me. But anyway, so what I do have next to me is, you know, some of the pros and cons. So we did this last year, Lynn Shoji and myself, and she actually kind of like roped me into it. You know, she was like, come on, do it. I'm like, okay, you know, without knowing. But she's my mentor. She's been with me and helped me, and I said, okay, if you're on board, I'm going to be on board with you. And we had such a wonderful experience. When we started, it was actually later into, you know, the near the end of the third quarter, beginning fourth quarter. So we were only able to do 2 of the modules, but you know, we did a lot of record keeping about what the kids experienced. And then we, you know, and these were 9th graders, and surprisingly, they had wonderful feedback about what they learned. So module 1, you know, they learned about the quarantines of the past, you know, diseases and illnesses. They said they loved the timeline and the statistics. Things that they liked were the links, because they said that they could go back and refer to a website and stuff like that. They said some of the slides were too wordy, maybe having bullets. They learned about health and Hawaiian history together, so that was good. I have like 30, you know, of these. The slides were well made and informative. It was good altogether. I didn't like all the words. It was very rich information, you know, so each kid had like a lot to say about it. So I felt like, wow, this is an awesome start. And we provided that feedback to, you know, the people in charge. The other one, which I wish I could show you guys to pull up the family trees. They did a lot of hard work on it. They were actually making differences for men and lady, gender differences, all of that stuff. They did colors. But the one thing that we did notice was that most of them said, oh, our family doesn't have any underlying health issues, so, comorbidities, right? Like none of them had diabetes, or none of them had high blood pressure. And me and Lynn, we're listening to a first one say, and we're like, okay, lucky you. And then like, 10 of them said that, and we're like, okay, what? So we felt like a couple of things: either they weren't actually asking the deep information parts, and they just kind of told their mom, oh, what is this and that, and then, or they were too ashamed to share that, or so I think that part needed to be readdressed with them, because we know that, every family has it. If you're a grandma or grandma, my age, I'm pre-diabetic, so I don't have that, but so we knew that was not real straight up information, with all of them not having it. But they really did a point of doing the good coloring. Okay, and then also I'm not teaching it right now. We have other things to do, but I'm hoping that we can do it and go through all 4 of the modules. But some of the feedback that I wish, Dr. Pauline and I talked about a pre-survey and a post-survey, which wasn't built into it, but this year, like Kaleo did, I would love to put that into it. But we just got a letter from the superintendent today saying, oh, these are the things that we're doing. We had 833 cases. Okay, well, the last time they had shared that it was only 400, so it's doubled, okay, since our last report out. And it's like, wait a second, how can you say this is a safe place if, like Kaleo's kids, there aren't social distancing being practiced, especially at lunch and all of that? And the press, the media, no one is really seeing this. And I walked around today and I saw, it's like Lollapalooza, no masks, all close together, and none of this is getting out to the public. So along with us educating our kids, we've got to do a lot more. Kaleo's school has wonderful community, with all of the sharing. We have some of that, but I don't think it's listened to as much as, we had a kid that was supposed to be in quarantine, came to school, and the mom got called twice. And the person calling said, look, it's quarantine. Your kid's supposed to stay home, not go anywhere. And she's like, well, I'll talk to him, but he doesn't listen to me. And it's like, so even with that kind of situations, that's our clientele. You know what I'm saying? So it's going to take a lot. And some of this might need to be done at the state level in all schools, where we adopt some of this kind of education stuff. But I think it's a great program. And I'm looking forward to sharing it with my students again, and seeing how far more we can take it, because this is kind of like our round 2. Anyway, thank you. If you have a question, please ask me.
Thank you, Jamie.
Thank you for the opportunity to be a
Thank you
part
very
of
much.
it.
Yeah, thank you very much, Jamie. I'm sorry you had technical problems. We have a little bit of time. We did have a little bit of sliding on the timeline. So if you would like to just say anything further, perhaps on your program, that would be great. But then what I'll do is I'll go to the next person, the next panelists, and that would be Kaleolani and olinokaimana. So do you have any final thoughts before we?
I just, want to say thanks for the opportunity. I hope it could be shared with more teachers. You know, like I didn't know about it until Lynn just, like I said, she just called me out of the blue, and that's how I found out about it. And then I think it would be awesome to have it as an interdisciplinary, where you got your social studies teacher working with your health teacher, working with the science teacher, working with, you know, but in big schools, I don't see how that would work possibly, you know, but I mean, it can go so far, really, it can. And I would like to see more promotion of it in the school setting, you know, and I wouldn't know how to do it, you know, like, because like I said, I only found out about it through Lynn, like calling me on the cell phone.
Right. Okay. Thank you so much, Jamie. What I'd like to do now, if you're going to stay with us, and there will be time to have questions and answers from and comments from the audience, and there's quite a lot in the chat right now. I'd like to introduce Kaleolani again, and she will be accompanied by olinokaimana. And for the next 10 minutes, they're going to talk about how they have been collaborating. They are curriculum writers. They are part of the PAC team as curriculum writers and implementers. They'll talk about teaching for COVID and especially focus on student outcomes. Thank you, folks.
Aloha, everyone. My name is olinokaimana, Yasuoka. I have taught in various charter schools, and this olika here that I'm going to start off with, we're just modeling something that we would do with our students to create routines, because right now routines are very important. And I learned this oli from Kawaihona Okana'awa Public Charter School. Umayau he Hawaii, e hoi. E malamai na kuleana, e maliu mai e.
Olu na pena la au I ka olu he mai ke ala ai. Aloha mai e homo mai Aloha. Aloha mai e na hoa maka maka o wau iho no o Kaleolani ho. Aloha, lovely to see you all one more time. This particular oli is our oli komo. And this oli was written by Kumu Tena Ala Haika Lama. And, you know, it really is the grounding for me and my haumana every single day. So outside of our classroom, our students gather, and this really brings the sacred into the learning. And so it is the place that I choose to inform them about how our day is going to start. So when the haumana are outside and they are preparing to come in, right after their oli, I actually tell them, please make sure your masks are covering your nose and your mouth properly. I also will remind them during the oli that even if they're outside and they're standing 3 feet apart, I will remind them with my fingers, because they have it over their nose, they have it over their mouth, they have it underneath their chin. And so, yeah, I do address those before we even start to oli. When they come in, before they do, I ask them to please make sure they assume their same chairs for contact tracing. And then right after that, I actually wait at the door and I actually sanitize their hands with the sanitizer that was given to us by the Department of Education. I also meet them outside the door when they're leaving. So we are going to actually go over the lessons that we launched last year. And I am going to start first. So this is what the lessons look like on the module. You have lesson 1 or in module 1. Module 1. Module 2 is your Mo'oku Auhau, my genealogy and beloved Ohana bubble. Module 3, protection and prevention. Module 4, testing, vaccinations, and variants. And I want to just right now just briefly thank my team and everyone that has been working in PAC all of these months. When you enter into module 1, these are the familiarities, the spaces, the little launching points that you will see. This hale here signifies the first real dedication of our people to combating any type of infectious disease. And you can see that it's landscaped on the background of the iconic Diamond Hair or Le'ahi. Then you will journey into mapping of not only Hawaii in the Polynesian Triangle, but also looking at the Marshall Islands, part of Samoa, and the situation with the 1918 epidemic there. And then in Samoa, 2019 again. And then of course, we then take you to some of our primary documentation, which we feel is the signature of the historical piece about Kina'u here and her taking public health during the kingdom, and ho'omalu, which is something that olinokaimana will talk a lot about. Ho'omalu ikawa mamua, a ho'omalu no ikawa mahope. Protect the past, and then you and I can protect the future. Little morsels that lead us to the bigger mapping of what we should be doing today as far as leadership is concerned. Moving on to, of course, Lili'u o Kalani in 1881, who was at the time Princess Lili'u. And I wanted to bring this up to all of you because this is what charted my journey into leaping into creating 4 new lessons in COVID prevention. It was this article sent to me by Dr. Chin. It was about 12 o'clock at night. I read it. I think it took me like 5 minutes, and that was it as an Olelo Hawaii teacher and steward of Olelo Hawaii. And seeing the new Peppa, it really resonated to me. She was not popular. She made choices without having her brother at her side. She took her regency super seriously, and she went ahead and she saved our people by closing down Honolulu, which again, like I said, businesses, merchants, many of those that were already spotlighting to target the monarchy. This was not popular to them, and yet she went ahead and did it anyway. And for that, we are grateful because she sends us many messages when you look at the timeline. And these little pieces of the curriculum are in our modules. My students use this after Dr. Chin and with the help of a beautiful Kupuna Kekuni Blaisdell, who I had the awesome privilege to learn under when I was at the University of Hawaii, put this together for us. And having his ingenuity also look at old technology with new technology made me realize and wonder, how might I use this piece to bring into my classroom the validity of searching and researching the historical nature of infectious diseases in Hawaii. And so with the help of all of these wonderful, useful hyperlinks, my students were able to use this lesson in module 1, lesson 2, which you will find in the module, in the curriculum. You may use all the lessons, they are free. They were able to develop module 1, infectious disease, informational activities that were presented. And this was done in discourse in my class. One student finished all of this and then presented. My uncle had COVID. He is a pilot and had to take a leave for almost 1 month until he fully recovered. His wife would have to bring meals to the door, and one day his kids surprised him with a 5-course meal of the worst combinations of food, from turkey burgers with crickets and some exotic foods, because he lost his sense of taste. This student who chose to do COVID, my uncle has recently passed away from COVID-19, and it has a really hard impact on his family. He contracted the disease from a trip he took to go out with his friends, and it made us rethink how we are not invincible and how we can still catch the disease regardless of how healthy or strong we think we are. The virus also affected the way we celebrated his life after his passing, which also made it harder. So, really kind of diving into that sense of Hawaii and Oku'u Hawaii Aina Kilohana, yeah? How do we help our Haumana get through trauma? of this nature brought on by, you know, a infectious pattern of, you know, illness and even into death. How do we help them? And so one more student, my grandma shared the measles, shared that the measles took away 3 of her friends. The last time I saw them was when I waved by outside their homes. It was devastating. People dying so quickly is so sad. Through this module, I just want to share with all of you that students were given a survey. They were asked, did they pass it 90% the first time they took it? Would you believe it? 28% said yes, but 72 did not pass the first time. And that made it really clear to me that they wanted to pass, right? They wanted to pass and they went back and they did it again. You can see it right here, in fact. And that showed me that our students and our keiki are not quitters. They want to do well. They wanted to learn this and they wanted to learn it well. And so thinking about the field or health and wellness specifically, some of our students told me that, yeah, this has changed me. I really specifically want to get into the field of health. I really want to be a nurse. I'm interested in either becoming a nurse practitioner. I'm interested in becoming a part of vaccinations or know more about vaccinations or a vaccine specialist. I've always wanted to be a doctor and more specifically one day, a pediatrician or maybe even a psychiatrist. You know, this is not a normal conversations all the time in a classroom setting where students are talking about their futuristic plans. But for this particular module, it sure is. Module 2, as you can see, lessons 1, 2, 3, 4, and 5 was created for module 2 in creating your own mo'oku auhau and also creating your resilient piece that actually designs your ohana as one that is resilient and is able to move past and forward from this period. So in the module, you'll notice that you have wonderful informational outlines that help you to create this type of mo'oku auhau diagram. So this is mine, and I share mine with my haumana. I actually created with them. I'm the oldest of 9. And so you can see from a large intergenerational family, the intergenerational discussions that we had with our kupuna. And then of course, leading to my parents who now have to transfer that information to their mo'opuna on the bottom here, made it very powerful to know that my family does suffer from some comorbidities. Now, I'm not afraid to share this with my haumana only because I know that in my practice, this is what makes our haumana and myself stronger. And we build better, more stronger families resiliently together. When they know I am building mine, at the same time they are trying to protect theirs, it shows a level of community or ahupua'a. Working together, all hands, huli ilalo. It shows them that I'm not afraid to share also what is going on in my ohana with them. And how do I do this? Well, Jamie actually brought that up, right? She shared about, oh, sorry, everyone. She shared about using all of the statistical information that helped us to align our ohana in a committed format. She also shared that they put it into this documentation where they could also share it on in a form that collected all their data about parents, grandparents, and siblings. But then this is the outcome. After we were done sharing, students shared that this is my ohana, my family. These are my aunties and my uncles and my cousins. This student just went ahead and she decided, I'm not going to just share my parents and my grandparents. I'm going to share their siblings and I'm going to share all of my cousins because that is my ohana. And then if you look at her resiliency piece, the people that are in her hair are her grandparents. The people around her neck are her parents. And the people in her tutu dress are all of her cousins and her aunties and her uncles. So beautiful. It made me cry when I saw that. And I'm looking and correcting during DL at 1 and 2 o'clock in the morning like the rest of you. So this really got me jazzed that something was going on with my curriculum. When you look at the bottom one, this is from a young man. And in his story, he tells us about grandma. Grandma lost her triplet, two sisters. So she is one of triplets. And when he drew this, the family shared with him that grandma believes the tiare blossom is the sign and symbol of resiliency. And so when he drew this, he shared with us that every time their family sees the tiare, they're okay. They're right on. They are moving forward and they're fine. And their kupuna are watching them. This student never came to class with the dolphin and the porpoise. This student doesn't talk. This student rarely shares anything. But when I brought this mo'oku auhau information to her, look at this beautiful piece. She felt that this student she felt that this lesson not only brought out the pieces of her that was the most important to her, but it allowed her to take back the information to her family, and she became important. Her parents were listening to what she had to say. Her grandparents were wanting to share with her. And that's what made her come out of her shell and express thoughts and ideas verbally with me. And that was really beautiful to see that transformation. The student below is a young gentleman. This student shares how their elders longed for the life they once had when they lived in their traditional home in Samoa. It was destroyed in a hurricane. And he shares that during COVID, it's been very difficult. They've moved 2 or 3 times before they finally settled here in Ko'olauloa. And would you believe it? He had submitted this on way to Vegas because they no longer live in Hawaii. During the pandemic, he actually presented this from Vegas because they had to move again. So that should tell you something about SEL, yeah? They threw those words around, but during our greatest moments as teachers, social emotional health became like the lifesaver and our connectivity to our keiki and our haumana. I need to ask Pauline for time. Could you please give me a time? Oh, I'm sorry, you're muted, Pauline. I don't want to go too deeply because I want to give Kaolino some time.
Right. You have until 4:05. My watch says 3:58.
Okay, I'm going to finish this up really fast for everybody. But if you really take a good look here, and I know you guys have kind of like did a little browse. Again, students in module 2, 90% of them have to pass or else they have to go back into the module and take the assessment. Again, 71% of them passed this time. So what does that tell me as a teacher? The first time they didn't take my notice that 90% and they're not going to pass. But this time around, my students were definitely aware of the testing. They were definitely aware that they needed to pay attention to it and they wanted to succeed. If you notice too, look here, 5 did not pass. One did not pass and he actually or she went all the way to do it 5 times. What does that tell me as a teacher? This student wanted to prove to me they weren't going to quit, that they were going to continue to take this and they were going to pass. They were so determined. This information from Mo'oku Auhau really resonated with the student and with majority of, look at that, 58%, 22 of them. I'm going to get this on the 90th Kumu. I'm going to do this. So our students have the potential. What made me very happy was that they started to look at careers again. And this time was this unit sparking an interest in a career working with children? And the numbers went up. I literally had more students that left the maybe into possibly. And the ones that were no, maybe they went into maybe. Maybe they actually were thinking. And then what if I did this survey again now? Now that they know that we have a shortage, now that they know that there are planefuls of people coming here to work in our hospitals because they're overwhelmed. You know, our kids are very akamai. They are watching this news and they are shaking their heads and wondering, geez, how can I help? How can I be part of the system of support? So did you share this learning with family members? Look at that. 53% of our haumana said yes. I was so excited about that. And then survey number 10 asked them, survey question number 7 asked, what information sparked an interest causing you to deep dive? Survey 10 asked, if yes, what did you share and what reactions did you receive? Student reactions were amazing. They were saying that I never knew my grandma had comorbidities. My father would have never shared any of his problems with me had it not been for this presentation that I gave to him. My sister and brother were telling me they never learned this in school. And they were telling me, oh my goodness, I think you're smarter than us. You know, for a younger sibling to be smarter than an older sibling, for kaikua ana kaikaina relationships, sharing valuable scientific work makes them now a leader in the hale. At such a younger age, they become now, you know, they transcend into leadership. So I'm going to turn it over. My time is about up, and I want to give my colleague as much time as she needs. So aloha hui ka olinokaimana pehea oi.
Mahalo. So I'm going to switch to sharing. I kind of changed up some of my slides. So based on what happened yesterday, I wanted to kind of think about what the audience in here wanted. And I did want to show that there are revisions that are being made. So they're not embedded in the modules yet, but I am trying to make it really interactive. So I do have, so one of the things I really think is important about our modules is it's a way for students to stay informed and educators to stay informed, because that's really important in order to have awareness so that our students can analyze and then they can be prepared, right? And so I do have different slides that I'm creating for students to actually put these pieces together. So the students are going to build their pieces. They're going to be doing the research, they do the inquiry, and they're going to build the pieces to understand why they need to protect each other. So that's what's in progress right now. And the reason why is because this pandemic is dynamic and it's ever changing. And a lot of people just kind of look at it from one lens, like before everyone was just kind of looking at it like, oh, this is what we did for the original variant. But we really need to use more like a dialing up and dialing it down, because we're going to be seeing other variants as well. So right now we're seeing the Delta. So we want to be able to dial it up and dial it down based on the variant of concern. So we want to be able to look at our risk factors. So this is something that we embed into our module, is having the students think about it. So it's really the key part is really the critical thinking part, right? We don't want our students to have to turn to like listening to other like the social media, or even maybe sometimes government entities are not necessarily being really transparent. But if we give them that foundation of information, they can measure the risks themselves, right? They can see what is decided to be safe and what is decided to be risky, right? And so, and then they can adjust their behavior accordingly. So that's really critical in our modules, is to teach that. And so I really feel like with the Delta variant, we need to use a multi-layered approach 2.0. And what I mean by that is, here are some of the things you really want to make sure that you have embedded into these layers. Because every layer that you have is going to, is all these, you see this mouse right here? And he's trying to find a way to get through the, and this is the virus right here. It's trying to find a way to get through the holes. The more layers you have of protection, right? So those of you that are working at schools or even in the community, you want to make sure you have these layers in place, because the more layers you have, the more protected your students will be. So the last thing you want to do, so the American Academy of Pediatrics, yes, they did recommend that we move to in-person learning. But another thing that they said is they want to make sure that everyone is taking all the necessary measures to limit community spread, right? And if we take away some of those, like some of the schools, like not all schools are doing exactly the same thing. This is for public schools, right? Each public school is doing something different. And so one of the things we wanted to help schools understand is, if you take away some of the layers, the critical layers, you're actually giving more holes there where the virus can spread more easily, where especially with the high viral load that we have here and the increased contagiousness. And so my module here, Kuho'o Malu, is inspired by Kumukawai Kapuokalani Hewitt. And it's really, the vision for our whole team is to bring everyone together. So Kumu, when he said Kuho'o Malu, Ho'omalu is quarantine in Hawaiian, but really Ho'omalu is about caring for each other. So let's stand together to protect all of our kids, not just vaccinated, right? We need to protect our unvaccinated and our vaccinated, because we care about all of our homana. And so how are we going to do that? And why is that important, right? So if we look at this, one of the things we need to remember is we want to dispel the myth that children cannot be impacted by COVID-19, right? There's long haulers, the Delta variant, we see an increased rise of pediatric cases, right? If we look at this data sheet here, So that's one of the things we're finding is the data that is being produced. It's really a way that you can use math in a way, in a relevant way, in an engaging way, to look at the data and compare the data, right? So here, if we look at Hawaii, it's up 25% from this time period here, right? So the original time period, it's now up to 25% that we have pediatric cases here in Hawaii. And I'm not sure if you can all see this, but if we look at this, this was taken in July 20th. You can see all these light colored cases, that's only 35%, less than 35% vaccination. But now, as of August 25th, we can see, so you can show your haumana, if you save your data, so that's something that we're doing on our team, is we're saving these images because you can see the growth, right? And we can think about what is the growth. So I know Ruben was saying, well, maybe it's because of the required vaccination. But if we look at the children here, right? So I'm going to show this data chart right here. Before on July 20th, there was only 44% of children that were vaccinated, and now it's up to 51.7%. And it's not to say that everybody has to get vaccinated, but I just want to show that these kind of charts can show the growth that's happening. And that's what we're trying to do with our modules. I'm also creating a battling disinformation toolkit, and I can share the link later with all of you. I shared this with Damien because they were interested in teaching their students how to battle the misinformation that's out there, whatever it might be. It might not just be only about vaccination. It could be battling disinformation about anything, any kind of news that's out there right now. And we really want to make it clear that when we work together, that's why we're reaching out to educators, because there's so many educators here, right? We can make a difference, right? If we look at when we use protective practices, this is how the cases can go down. This is without any protective practices. So that's how critical it is to use these protective practices. I know that someone was asking about masking. And so something that we do at our home, because we have a son, he's going to high school. And so technically we don't know who might have COVID-19, right? Because of the asymptomatics. So when he comes home, we actually all wear masks, especially because we have an 89-year-old and an 86-year-old. Even if they're vaccinated, we all wear masks at home, in our home, just to protect the elders that we have here. So that's some of the things you can think about. It's also been, in this module, I'm also embedding, the experts are saying now to use KN95 or KF94 masks. So that's also embedded in here. And the need to make sure that every part of your face is covered. That's really critical, because that's how you're going to keep the virus out. So one of the other things, this is actually in one of my other, the original module, but here is a phenomena experiment that you can try with your haumana to help them to understand aerosolization in their classroom. Right, so if you have really young children, I was thinking, like, what is something that would help them to comprehend this idea of aerosols in your air? And I thought of bubbles, because they love bubbles, right? So if you had one student blowing bubbles into the air, into the classroom, they could just see, oh, there's not that many, right? But then if you have all the students blowing bubbles, right, that's the emulating the virus in the classroom, and that's just a scaffolding. So you could do the bubbles first, and then you could do then you could take it to invisible, right, with a fragrance. So you would spray the fragrance in one section of the classroom, and then the students would think about what's happening, and they could create pictures. So at first, what the important thing is that you don't get upset at them if they can make a mistake, because they're building their understanding of this concept, right? And that's what we want. That's how they internalize it. And so you spray it once, that's like the original variant's viral load. And then later you spray it multiple times, because this viral load of the present Delta variant is 1,000 times. So I'm not asking you to spray it 1,000 times, but just helping them to see that the more times you spray it, right, they can see the intensity of that fragrance, right? And that's something, they can't even see it. And then you can teach them the concept of diffusion in the air, right? And so we're not going to really get into the CO2 monitors and things, but that's why having a CO2 monitor would be important. So these are the kinds of lessons that we want to embed into what we're doing, so that you can have your students do the reading, the writing, the science, the history. It's all going to be embedded into the modules. Mahalo, Pauline. I believe we need to move on, right, Polly? Okay.
Yeah, it's
So I'm going to
4:10.
stop sharing.
Okay, thank you. Mahalo, Kaulino and Kaleo. It shows that what we are doing and what we are hoping to do is to keep moving the curriculum to be updated and to respond to current issues. What is going to be really important is that please go back and visit the website, because every time the curriculum is updated, we also update the quiz. So the important piece is that if you would like to get certified, until the modules are changed, the quizzes will stay the same, and teachers who decide to get certified will be able to apply for incentives as part of the certification process. So please do give your school address, your name, the grades that you teach, because this document is going to not accept people who are out of state and not accept people who are not K through 12 teachers. So just kind of be aware of that. And we invite you to do this, and to do this by September 15, so that all of this can be processed. I'm going to now open it up to questions. And again, I want to thank Kaulino. You can see that we're really, really dedicated to this. Our hearts and our passions are in keeping everybody informed and safe. And looking at it from an interdisciplinary way, so that people can understand that they're part of a network that extends through the school and into the community and across generations. So if there are questions and comments, I will look at the, there was a comment about how making sure that if you're a language arts teacher, that you are actually able to use the COVID curriculum to address some of the language arts standards. Would either Kaulino or Kaleo like to address that?
For myself, I'll speak as a 3rd and 4th grade teacher. I was teaching 3rd and 4th grade. And I would say that a lot of times people don't want to push their students to do reading, especially if students might not exactly love reading. But what I found in 3rd and 4th grade is if you create a classroom where students find what you're doing engaging and interesting and relevant, and you make it really compelling, it's issues-based, they want to do the inquiry, right? You create a list of questions, and they can jigsaw the questions, like I'll take this question, I'll take that question, so that they're not doing the whole research themselves. And by doing it like that, they can puzzle it together. So that's kind of the introductory part I was doing about the puzzle. But you have your students, and I really find that I found my students reading, like students that were in Title I, by the end, they're with me for 2 years. We do 3rd and 4th. By the end of those 2 years, they're out of Title I. And they're writing me all these questions, and they're giving me new issues like, oh, Ms. Yasuoka, we need to cover this. And so please make your students hungry for reading, because if you do that at a young age, it just gets easier and easier as they get older. So don't be afraid of reading. And I'm also a writing teacher, because in elementary we do everything, and all the writing that is embedded into this unit that can be embedded, it just enriches your students' learning experience. Mahalo.
In place-based education and Aina-based education, one thing that's very prevalent for the Haumana is constantly asking them, what did you learn? And so every opportunity, so sorry. With every opportunity my students have to read and write, it is in this module. There is so many wonderful mo'olelo in this module, and then things for them to actually look at and tinker to and kind of analyze, that the writing becomes so much more connected to who they are in place with their families. They start to talk and draw from personal experiences like you saw in the interviews. And I found that to be much more valuable during DL when they weren't physically in my classroom, when I really had to call parents to make sure that if their Haumana was okay, because, you know, they were signing off, or, you know, the distance learning was not working well for them. And so I just wanted to say, if you just give it a shot, there's so much more there, so much more meaty periods in which kids can also, through voice and choice, choose for themselves, Miss, can I write a 5-page narrative about this particular issue on vaccinations? Can I interview 5 people and get their response? It really is something where you as a teacher steps back and you actually let the kids deep dive. It is such a beautiful opportunity to see what happens with this curriculum from their perspective. I wanted to
Mahalo.
also invite Jamie. Hey Jamie, how about for you in that question? What has happened in your classroom with reading and writing?
Sorry, gotta find my mute button on this.
You're fine.
Reading and writing, you know, a lot of it when we had distance learning, we kind of just talked to them and we had them verbalize it, and then we took notes as to what you know, they said. So they didn't really do a lot. And you know, with that family tree, it was pictures, yeah. So I'm more of a picture kind of person with all my projects, so I kind of like that. But the reading, as far as them looking at the historical things, I know they were reading it because, you know, when they took the test, they were able to pass, or if they had questions and they looked at links and things like that. But you know, as far as my preferred way of projects is more pictures based. I'm more like a artsy kind of teacher where you know, that's how I have them do it, because I like the thinking process when they have to use pictures instead of words. And I find that some of their pictures are so deep, you know, and that's why I like it. But they definitely, they read, you know, but not, I haven't seen it make an increase.
Thank you. Let me direct a question. This is from the chat to Ruben, one of the panelists, to see if you feel what you can answer for this. The question was any of the recent, in the past 20 years, research on resiliency? Now, this would be Western knowledge used to interface with the Hawaiian knowledge and values to develop a mental health aspect for these lessons. Ruben, if you'd like to, and then I can take a piece of that too. But if you'd like to address that, because I know you're doing really important work that suggests that students that are doing a combination of kind of Western frameworks and combining it with Hawaiian cultural knowledge and practices have better outcomes.
Right. So we've been working a lot with Mao Farms, recently expanded to the Hawaii food basket, basically just training individuals who basically come from underserved backgrounds and go through a nice structured curriculum along with AINA-based education, and look at the impacts before and after going through that. And what we found is that there are health outcomes, so positive health outcomes. Some of that, for instance, from our organic farm, where we find that 60% of individuals who were already coming from with being pre-diabetic, some of them even diabetic, 60% of those individuals improved the outcomes after 1 year, basically decrease the level of diabetes. So yeah, so other than that, that's everything that I can say. So I don't think that there is a specific impact that we have been measured on this, especially with regard to mental health. But I do know that there are some programs that we've been looking in the past that reduce, basically that increase the self-esteem of individuals. So, but that's basically using a standardized Rosenberg scale. Other than that, I'm not aware of that.
Thank you. One of the things that we thought about as we developed the curriculum, and you can see these kinds of data coming back from the work that Kaleo is doing, is that we wanted to build into it Naho Pana'ao. And so what we're looking at is that we want to build social emotional learning directly into this. Okay, so what is the research that shows this? There is several articles by a woman who is working now actually at Waimanalo, Oneha, O-N-E-H-A. And what she has done, a lot of the studies were done in Waianae, and it had to do with how people felt, how they felt stressed. If you look at some of the indicators of health, and I'm teaching this in one of my classes now, and I'll put that into the chat later on. You can see that Waianae has some of the worst indicators of health and economics. It's rated a 5 out of a scale of 1 through 5. And so what she found was that when they did the survey and interviews, that people would say that they didn't have an opportunity to practice their culture. They didn't have a chance to use their language. They didn't have places that they could work to do their planting. All of these things that connect people to Aina, which is not just the land, but it is really a land where there is identity and there is belonging and there is this ancestral connection. So this is really deep when we think about how we work with our haumana, because it actually addresses very, very important dislocations that have occurred during the transition for over 2 centuries now, from the original Hawaiian ways of understanding relationships and with land and other people to a more Western individualistic competitive relationship. So again, Oneha, we are trying to contribute to this, and this is exactly what is important for us to study, because if we can bring people back not only to knowledge and health, greater resiliency in terms of COVID-19, we can also hopefully give people strategies to live more sustainably and in better ways with the people around them, and strategies to address issues. So I hope that's a little bit better. I will put something in the chat later on, or so that you are able to see some of the data that I'm looking at. Would there be other questions?
There is a question on trust, Pauline.
Yeah, right.
How do we measure trust?
Right.
For the studies, so we focus on whether individuals, we actually specifically asked them to tell us. It's a semi-quantitative analysis, qualitative analysis. We asked them to tell us whether they trust the information coming from specific sources. So for instance, from the government. So does the information about say COVID-19, is it reliable? Do you think that is reliable? And we ask you to rank it on a scale of 1 to 5, basically. And we do the same thing for the different sources of information. We do the same thing for media. We do the same thing for basically your healthcare provider. And the results that I share is based on that specific questionnaire that we have. But there are a few other ways, by the way, to measure that.
Are there other questions for the panelists? Would somebody look at the chat I'm currently and monitor that? Okay, let me see there, because there are really a lot of new messages right now.
One here says, oh, go ahead. Kaulino, go ahead.
No, I just want to quickly share about the certification process. Is that okay? Or you want me to wait till a little longer?
Certification. If there are questions in the chat, the certification, it's 4:25. So if we could do that at the last minute, the last few minutes. Kaleo, you had some comments?
Yes, there's a question here about achieving student work for a future museum for children in Hawaii. You know, because I rolled this out with the resiliency piece during DL. A lot of the artwork from my haumana are really in their spaces. right? We didn't take in any paperwork from the kids. We didn't do any type of transfer. The most we did was maybe just a syllabus that was maybe sent home and they accidentally printed it and sent it to me. So as far as all of the artwork that you saw me share, as well as all the artwork that I do have in my Google Classroom, they have the physical pieces with them. So I do have a digital piece of it. And I'm not quite sure if we did take this as authentic work, would people be interested in more of the authentic work that is hanging in a space, or are they really wanting to see our total work of family resiliency? And I want to also share that every time I open up the Mo'oku Auhau, I always tell my haumana, we are the ones that people will be running to ask, how did you survive that? What did you do? What was going on? And how are you able to transfer that knowledge to others, especially when they become parents of their own children, to have this story in their back pocket? And so that's why we as teachers literally can help them with the scrapbooking right now, little poems, creating multiple opportunities for them to do flip grids, or having interviews with grandma and grandpa and putting it in a real online portfolio. Those are wonderful scrapbook pieces that children, students, even each other, that we can pull out later on when we want to share this story, this mo'olelo. Remember, we're in a new va. If you look at the Pele and Hi'iaka stories, that was a va, right? A time. And it does give a ka'au. And so we want to make sure that this ka'au is told by us. This is our story, our authentic words. So just sharing that with all of you.
Mahalo, mahalo. I did put into the chat the link to what is called the 2021 Hawaii Social Needs Index. And there should be live links that do not seem to be showing up. But if you paste that into the browser, Hawaii Social Needs Index, you will come up with a very comprehensive way for every zip code, looking at the different kinds of factors that you can kind of indicate, will indicate who's underserved, which populations are vulnerable, which have the poorest health outcomes, because this is a way that that index is established.
Pauline, can you repaste that? Because I don't think we see that.
Okay. Oh, I didn't show that. Let me see. There. I'm sorry. Okay. So this is an important one, and it's geographic information data, and you can look at it for multiple ways of assessing in the zip code where your students come from and where you teach, some idea of the social stressors and that need for teaching to be resilient. Okay, so we have a few more minutes. I'd like to turn it over to maybe one last question, and then we'll try to address things via email or in the chat. And then I have to turn it over to Kaulino, because we don't end the workshops with this. We hope to be able to continue and build a network of educators and researchers.
So there was a question about cohorts. So at my school, because we're 5-on-7, we do not have cohorting, or we would call ohana bubbles per se. So what we do have, it's a 5-by-7. Teachers are asked to have seating charts. The students are, programmed into those seating charts. Should there be a contact tracing issue, a phone call will be sent to your room or to your personal phone asking you, this student sits here. Are you 3 feet distanced apart? And I would say, yes, we are 3 feet distance. If we are, then it's good. If we are not, then what happens is that they will ask Dad, can I please have your seating chart? And then those families will be contacted to be told that the student sitting or near your child that was not 3 foot distance or may have been over 15 minutes has been exposed to COVID, to someone who has COVID. And so therefore, that is how we are doing our tracing. And then they will have to be notified. And then some families choose to just do the 10 days and keep their kids home. Others are getting their children tested. I hope I answered that question.
Mahalo, Kaleo. Veronica has put in the website for the, and I can do a real quick screen share. Let me see if I can get into that here. Okay, let's see. This is it, folks. Okay, so this is the one, and you'll notice that you are able to look at your Oahu, let's say, okay, and then you can expand it. Okay, now you see that thinking about where you are, but it also has all of the other other islands, excuse me, other islands as well. So you can drag it down and then you can expand it until you see the areas of vulnerability. And again, the level 5 would be those that are highest at risk on multiple factors. Okay, so you can just hover over these things and you actually get the data that says what's the level of risk. So as you begin to think about this and you begin to think about who do I serve, are my students very privileged? And so I think now a little bit about Jamie's comment. Maybe they don't talk to their grandparents because maybe a lot of them, their grandparents live somewhere else, or maybe they are reasonably actually coming from a very high income area. This is the area where Jamie teaches. Okay, let's look at that. This whole area. This is the top level. So maybe their grandparents are actually in really good shape. So you can see that as you think about curriculum development, now this is going to be Kalihi Palama, you will want to target your curriculum to be able to support students, and for kids that might be quite privileged, have them become more empathetic. And I think this is one of the real important things that comes out of Kaleo's work, is that when students go through the curriculum, they begin to care about other people. And that's what Ruben shows too, is that people care less about themselves than about the people they care for. And so if we are able to tap into that, and then we have increasing the knowledge base for the students, then we hope to have more trusted communicators. So this is really what our whole purpose is. So I'll do a stop share. I will turn it over to Kaolino. We're just on the cusp of 4:30, and to talk a little bit about enrolling, etc., getting certified. Go ahead, Kaolino. Thank you.
Yes, so our project is coming to a close as far as the modules will stay open access, but the actual, we are providing a Mahalo stipend to whoever gets certified. So we really invite you to make the most of that opportunity, because on September 16th, that's going to be our final feedback session. So you can provide feedback about the modules, but we also need to get everybody certified by that time. And so I'm going to be dropping the link in on how to do that. They're interdisciplinary modules. There's videos for everyone to watch. I'm going to drop this meeting. Our next meeting is on September 2nd. So those of you that have, I know that some of you had ideas for embedding into the modules as well. Please come to that meeting on September 2nd. We have 2 more meetings left. And so I'm going to drop that into the chat as well. Mahalo everyone for being here and joining us today. Pauline.
Mahalo. I see that there's still some questions, and there's still some links, and there's some requests for us to post our work, especially the ones that show student involvement and student work through the art. Why this is really important is that in our underserved communities, very often the pencil and paper kinds of assessment and the pencil and paper requests to show that you know what you're doing and to get assessed very narrowly We enable students to do it by art, by drama, by performance even. I would think that there would be many opportunities, as you saw from Alika's daughter, to draw something that represents how she feels and how she understands the relationship of what COVID does and what somebody can do to knock COVID out. So we'll try to get these posted, and we will try actually, as long as we don't reveal student names, because these are minors, we'll see if we can have a gallery actually on the PAC website. So I'll toss it over to Ruben. And Ruben, does that work? Does that make sense?
I think that's doable. Yeah. Just need to let us know when you guys are ready. Right.
So what we'll do is we'll kind of screen it to make sure that we do it according to our IRBs and institutional review board approvals, because when you have minors, you have to be very careful about revealing identity, etc. But some of the writings and some of the work that students do is very revealing. And it shows that they feel like they've connected to their grandparents, that they're able to show their love, that they have been able to help their family members. And I think that is going to be really important for the social and emotional learning piece. Any last comments before we end? If you have questions, we will save the chat. Anybody who's registered, you will be also getting a recording. And so put it down now or ask a question while we still are being recorded, because it'll go off pretty soon. Okay, any final thoughts? If not, it's 4:35. We've gone 5 minutes beyond. I want to thank our panelists from yesterday, Department of Health. Kara is very, very worried about, supportive rather, worried that you feel that you don't have enough knowledge. She said one of these days she could do a 2-hour presentation. So one of the things I'd like you to do is, in the evaluation, please respond what was most useful, and then what would you like to know, so that we can begin to, as this very quickly moving situation evolves, address your concerns as well as we can, to the best of our knowledge, knowing that we don't have perfect information at all times, and maybe anytime. So any other thoughts, panelists?
I just want to thank everyone for attending, and to you guys for doing a great job with this curriculum. This is awesome. And again, so this is the last chance to get up to $200 for all the teachers. So please come to pac.info/feedback just to get certified. It takes 15 minutes to watch the video, 10 minutes or so to pass the quiz, probably less than that. And you get $50 for every module that you get certified on, up to $200.
Mahalo. Any other questions or comments? If not, I want to thank everybody for putting time in and caring about what we're doing in our community, because I think it's going to be the ability of younger people, especially people in the community, to trust the messenger that will enable us to be safer in schools and in our communities and in our families. Thank you again. Mahalo, mahalo, mahalo.